Feel very much welcome to my YouTube channel. My name is Falgona, and today we finally get to talk about skincare. So on skincare, I'll love us to cover the first things first. And on today's segment, I'm going to introduce us to some of the conditions that affect the skin. I believe that by covering conditions that affect the skin, we will be in a better position to understand the product that we need to use on the skin, because from there we will know where we are coming from and what we are trying to treat. So allow us to move on with understanding, so that even as we treat ourselves or we take care of the skin, we are not walking in blindness. We know what we are doing, or we know what we are trying to handle. Now, I discovered that the skin conditions are so many. Actually, initially I was thinking of covering all skin conditions before moving to the next part of this thing, like the products part of it. But then I discovered that if I take that direction, we might end up spending the whole year on conditions that affect the skin. So what I decided to do, I am going to break the conditions into categories. We'll start with the most common one, and then as time goes by, in future, we will cover other conditions as time allows us. So in this segment, we are going to cover 3 common conditions, that is acne, hyperpigmentation, and scaly skin. So I will start with acne. And acne is a general term. It also has a number of conditions exist under acne. So many of them, actually almost 7. And some of the conditions are what we call blackheads, whiteheads, pimples, nodules, cysts, and melia, and so many others. So in this segment, I'll allow us to cover the 3 basic ones, that is whiteheads, blackheads, and pimples. But before I get into them, I'll allow us to understand how acne occurs, or how it is formed on the skin. So I will touch a little bit of biology. So we have the skin, and the skin has some hairs, tiny hairs. And the hairs, they originate from hair follicles. Actually, what we see on the skin is the tip of the hair, but it is usually a strand. It's a full hair follicle. So inside the hair follicle, around it, we have what we call the sebaceous glands. And the sebaceous glands are responsible for the production of sebum. So in layman's language, sebum is the natural oil that you produce on your skin. So sebum is good for the skin. It is supposed to lubricate your skin and makes it easier for your skin to absorb moisture. Then it's also supposed to protect your skin from certain types of bacteria. And apart from sebum, the other thing that we have on the skin is dead cells. The skin is growing, and as it grows, some of them die to create room for more cells to grow. So we have dead cells on the skin. And then the other thing that we have on the skin is bacteria. Some are just on the skin, then others we acquire them in the atmosphere as we walk. Now, when sebum is produced in excess, and actually it happens at a particular age due to many factors such as hormonal factors, when it is produced in excess, what happens is that it clogs the hair follicles, that gap or that space or that pipe where the hair comes from. So it clogs the hair follicle. And then it also happens that the dead skins also, when there are many of them, they also clog the hair follicle. And then there is bacteria. So when this excess sebum combined with dead skins meet with bacteria in the clogged hair follicle, what happens is that it gets infected. And in case the skin is still closing, or it's covering the opening of the hair follicle, you will develop what we call a whitehead. So these excess oils and dead skins will get infected with the bacteria, and then they will form pus. But since it is still closed, the follicle is closed, you will see something tiny, a tiny white spot on your face, and that is what we call the whiteheads. But the situations where the excess oil and the dead cells, they clog the hair follicle, but it happens that this time round the skin is not covering the follicle, so it is open. So this excess oil and dead cells with bacteria, when they are exposed to air, this time round, since the follicle is open, it is not, okay, it's clogged, but it is open. When they're exposed to air, they turn black or dark brown in color. That is what creates what we call the blackheads. Then the situation, so both the white heads and the blackheads, they occur on the skin, but they do not cause any form of inflammation. So there are situations where we have the dead cells and the excess oil and bacteria, and the skin is covered, but this time round there is inflammation on the skin, and then there is pus on that inflamed part. That is what causes the pimples. So I can say that pimples is like a whitehead that is inflamed. Whiteheads are not inflamed, but when they get inflamed, now it creates what we call the pimple. And when it gets inflamed, it gets painful sometimes. So generally, that is how they occur. And some of the conditions that accelerate the occurrence of acne, we have hormonal conditions. So hormonal conditions, okay, it can happen when you are growing, you reach an age, especially adolescents. There is excess production of some hormones, hormone androgen, and it increases the production of sebum. That is, it makes sebaceous gland produce more sebum. I think it expands them. So you end up getting prone to pimples or acne. So there are many hormones that cause this. So one of the reasons, or one of the things that accelerate the growth of acne, we have hormonal conditions. Then we have genetic conditions. If you are born to parents that used to experience a lot of acne, it's also possible that you will also experience a lot of acne. Then we have some medical conditions or some medications. When we have medications that contain things like testosterone or lithium, you will find yourself experiencing acne. And then another condition, we have stress and diet. So stress and diet mostly affect your hormonal function, and at the end of the day, it may affect the production of acne on your face. Then the other condition that affect the face, we have hyperpigmentation. So hyperpigmentation, this is a situation where we have dark spots or patches on particular parts of your skin. So it occurs when there is a excess production of melanin. That melanin is deposited on particular parts of your skin. So it can occur when, for example, you had a lot of acne and then they are now healed. So when they are healed, they will leave behind dark scars. Or it can also occur when you are exposed to maybe sunburn. So sunburn will also leave scars or spots. Or sometimes you might use very harsh facial products, maybe bleaching agents, and then they start reacting, and then they will leave behind scars. So that is hyperpigmentation, just dark spots or patches on your face. And then the third condition, the scaly skin. So scaly skin is a situation where your face is dry, and then the external layer, we call it the epidermis, it starts to shed off, and it sheds off like some form of large scales, or it looks like flakes. So with scaly skin, it is caused by a number of factors, and we have conditions. Maybe you are exposed to changes in temperature, and there's a lot of drying. Maybe you used to live in a humid area, and now you move to a place where it's dry, and there is varying temperatures. It's going to cause drying of skin, and when it is extended, they will form scales. And then it is common amongst people who are aging and people who are experiencing menopause. It's not a must, but it's common for them. And then people who are just experiencing general dehydration, they might experience scaly skin. So with scaly skin, you might discover that sometimes the skin actually starts to itch. Yeah. And in case you realize that the itching is severe, it's advisable to go to hospital. But generally, it is something that can be handled. So all the conditions, the acne, the hyperpigmentation, and the scaly skin, there is a threshold that can be handled through skincare routines. But before you go the skincare way, it is advisable to just see a doctor or a healthcare provider so that you are sure that whatever you're handling is not a medical condition. Because if you handle a medical condition in a casual manner, it is very possible that it's going to be intensified. So before we move into the next stage of this series, how to take care of these things, I love to advise you, just make sure that you see a doctor so that you know that whatever you are handling is not a medical condition. If it is a medical condition, then you need to get medication. If it is not a medical condition, then we are going to walk through this journey together. That is all for today. We'll cover other things as time allows us in the future. But for now, look at your face and try and find out what are you handling, so that in the next segment, we will know what you're handling and move together. Thank you so much for tuning in. Until next time, may the Lord bless you and keep you. Bye-bye.